At 68 years old, this is how Bob Robinson is enjoying his retirement. He retired after nearly 4 decades with the Shreveport Fire Department. During that time, there wasn't a street he couldn't find. But one day, that all changed.
One day I was got a little bit concerned. I was having some problems remembering.
Bob's doctor ordered an MRI. It showed a large tumor in his brain. He was referred to University Health and LSU Neurosurgeon Dr. Christina Notarianna, who we saw in 2013 when a concussion turned into a subdural hematoma. That's where blood collects around the brain.
In order to undergo a surgery to remove that tumor and to try to get it safely out, you're talking about a very big operation and having to go through a fair amount of normal tissue to get out this tumor that is in the brain.
Bob's tumor was in an area of the brain that controls memory, vision, speech, and hearing. Open brain surgery could have impacted any of those functions in Bob's daily life. So Dr. Notarianna reached out to her colleague, Dr. Hai Soon, who's been using a new procedure that uses laser-guided heat.
The goal of the procedure is to use heat to destroy the abnormal tissues in the brain.
Dr. Soon used Medtronics Visualase system. Because of the size of Bob's tumor, 2 small incisions were made at the back of his skull, and a probe was inserted into his brain and the tumor.
The probe can guide the laser to the tissue. Then the laser, as a light source, began to heat up, and with the heat, the surrounding brain tissue is damaged.
Studies show that brain tissue starts to die at 50 degrees Celsius or 122 degrees Fahrenheit. Once the probe was inside Bob's tumor, the laser hit a peak temperature of 95 degrees Celsius. That's 203 degrees Fahrenheit. This laser is so precise, the center of the tumor is cooked, while the healthy brain tissue remains unaffected. 4 days later, Bob was out of the hospital and back at home feeling great and enjoying this view.
Excellent. Yeah, you can just say excellent. I don't have headaches. I've got a little bit of numbness, and that is because of, the surgery deal, just a little bit.
Since Bob's tumor was malignant, he's undergoing chemotherapy and radiation to control it. But he's not dealing with any issues that he could have faced if he had to undergo open brain surgery. For the University Health News Network, I'm Ed Walsh.